Welcome to A Healer in Every Home. I'm your host, Burke Lennihan, and today we have with us Dr. June Shibley. Dr. Shibley is a naturopathic doctor. She practices in Cambridge, Mass., and she's an adjunct faculty member, a doctor of pharmacy at Mass College of Pharmacy and at Northeastern University. Today we'll be talking about natural remedies to both prevent and treat colds and flu, very appropriate for this incredibly chilly winter we're having here in Arlington, Mass. So Dr. Shibley, welcome to the show. Thanks for being here.
Well, thanks for inviting me. I'm delighted to be here.
And I know you're going to have some special tips and tricks that most people won't know about already. So what would you like to start with?
Let's start with vitamin C. I think a lot of people don't really take enough when they get a cold or flu, so they don't even think it works. So the way you should take it when you have a cold or flu is to take a tablet or capsule, usually 500 milligrams or a gram, 1,000 milligrams in each tablet or capsule. They should take 1 to 2 of those every 1 to 2 hours while they're awake.
Right, and people are taking like one a day and then saying vitamin C doesn't work. Right, okay.
Right. So taking it this way, what's going to happen is eventually you're going to end up having soft stool, maybe even diarrhea. So that's not a problem.
It's just nasty.
It's inconvenient for sure. So all you need to do is stop taking it until the next day, and the next day take 500 milligrams to a gram or 1,000 milligrams less, and that should help clear up the problem with your bowels.
Right.
There's another form of vitamin C that I don't think a lot of people know about, and it's called liposomal vitamin C, and it is absorbed twice as much as the regular vitamin C. So that's a good thing. Unfortunately, it costs a little more though. So it's a decision to be made. They're usually in capsules or liquids. If liquid form is purchased, they don't typically taste very well. So what you want to do is put it in a beverage of some kind, but don't blend it. And certainly don't subject it to heat because that'll destroy the coating that makes it liposomal.
So you mix it in juice, but no Vitamix, for example?
No Vitamix, no blender, no Vitamix.
Okay.
The other thing to remember about these formulations is that that coating is sometimes obtained from soy or sunflower seed. So you want to make sure you read the label, you have a sensitivity to those.
Great. So I'm afraid we might be scaring people off with the idea of the diarrhea. And I think the important thing is that it's your body's way of telling you when you've had enough. It's actually safe to keep taking it until you get to that point because your body's using it up, right?
Absolutely.
So it shows you, if you're taking a ton of vitamin C and you haven't gotten to that point of loose stools yet, your body's actually using a ton of vitamin C. And you mentioned capsules and tablets or liposomal. If people are taking a lot, they might want to get the powder, which would be a sodium ascorbate powder. It's just cheaper and easier if they're going to be taking a lot.
To get as much as you need from it.
Yeah,
absolutely.
So those are the different forms of vitamin C. And I'm wondering about vitamin A, which is also so good for the immune system. Is that come in different forms?
So there's basically 2 forms of vitamin A. One we get from animals. That's the retinoic acid. The other one's from vegetables, is beta carotene. So in most dosage forms, they combine the 2 of them.
You mean most like a capsule or something would have both?
Capsule,
I see.
Now the thing about beta carotene is that the body needs to convert it, so it's half as strong as a retinol. And
but for vegetarians, they'd be willing to take more beta carotene.
Yeah, they just take a lot more beta carotene. So for a short term time, if you have a cold or flu and you want to get to higher levels quicker because the body has to convert, you might want to take the regular vitamin A if you're not a vegetarian, of course.
Right.
If you're taking vitamin A even at higher doses, you might, for long term, then you want to stick with the beta carotene because that'll certainly be safer.
Right. It's the same kind of idea with the bowel tolerance, is that your body, it's going to use a certain amount of the beta carotene, and if it doesn't need it, it's not going to convert it to vitamin A. So it's very safe to be taking high doses long term in a beta carotene form, right? Okay.
Absolutely. And vitamin A stimulates our immune system, and it also helps us to resist infection. And actually, retinol is decreased drastically by respiratory infections.
Weren't you telling me about, with respiratory infections, that they measured a 200,000 unit deficit? Was that true in vitamin A?
They were
something
actually
like that?
giving huge doses to children who had measles.
Oh, I see.
And
To
that's
try
how
to
they-
keep up with how fast it
Yeah.
was being used up in the system.
Exactly. Yep.
Yeah. Right.
So for generally for every day to make sure you're getting enough vitamin
Like
A.
a maintenance dose?
Yeah, maintenance dose for an
Yeah.
adult is about 10,000 units a day, long term. And of course, for acute, you could double that for a couple of days and it wouldn't be a problem at all, except for pregnant women. And they should really keep to the recommended usual doses of vitamin A.
I see. Great.
Yeah.
So I'm thinking about vitamin D because we know that in these northern latitudes, that especially in the winter, people are not getting enough because we normally get vitamin D by converting it in our skin from sunlight. And when we're not getting out in the sun, then people tend to get into a deficit of vitamin D. So I'm wondering, what are we going to do about that?
Right, and people that have darker skin colors also. So vitamin D is really good for our immune system, for our mental health as well. And there actually was a study in Japan that gave school children 1,200 international units of vitamin D daily. And what they found was a 40% decrease in the incidence of flu in those children.
That's pretty huge. Yeah.
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 So it really is a vitamin that we need. It's really important. And doctors should be ordering that test
Routinely.
for everyone, routinely.
For everybody.
And,
yeah.
in this northeastern area that we live in. So I ask my patients to get them to have their doctor actually measure their vitamin D levels. Now, the levels are generally accepted in conventional medicine anywhere from 20 to 40 international units. But some labs are actually starting to call vitamin D levels from 20 to 29 is insufficient. So 30 is, in my opinion, the minimum that you should have for a level. And folks with chronic immune diseases should probably have higher levels, more like 50 to 70. All right?
And when our patients get that measured, a lot of people are far below that.
A lot of people really are. Yep.
Yeah.
Yep. So there's a rule of 100, and that is taking the blood level that you have, and let's say you come up with a blood level of 30, but you have an autoimmune disease, so you'd like to be have it more around 60. So you'd subtract 30 from 60, that gives you 30, and you multiply it by 100, and that gives you 3,000 IUs. So that's what you would take to get up to the higher level daily.
Great.
All right. They'll prescribe a medication that's 50,000 international units of D2.
Wrong
Yeah,
form.
because that D2 needs to be transformed to D3, and they give that dose weekly. Now, in my opinion, I think it's better to give daily doses of maybe 6,000 international units if one has got a low level like that. And I've seen a lot of patients come in that tried the 50,000 units once a week that haven't really gotten their levels up very well.
I see
it
that.
just doesn't work that well.
I see that in my clients too. And I know that they'll do it partly because they have faith in their doctor. If their doctor is prescribing it, it must be better. And also because it may be, it may not cost them anything because it's a prescription.
Right.
But honestly, vitamin D is so inexpensive in the health food store. It's just
really
about the
is.
most inexpensive vitamin. So it's just worth it to pay out of pocket and get the right form that's actually going to be absorbed and boost up those vitamin D levels in the blood. Yeah.
Absolutely. I like the liquid.
Me too. Yeah.
You know, where you can get 2,000 international units in one drop. So
I took that form and I misread the label. I thought it was one dropper full. So
Oh.
I took the whole bottle at the rate of one dropper full a day. And then I did that home vitamin D test. And it was at really high level, but not the dangerous. Didn't you say 100 is like that?
Yeah,
no,
you want to be under 100.
It was like a 75 or something.
No, another thing to consider if you're taking high doses of vitamin D is to take vitamin K2 along with it. And this makes sure that calcium gets into your bones and teeth and not deposits into your tissues. So that's the only other thing to remember.
And again, in this case, it's K2 that people want.
K2,
Yeah.
right, right.
Okay, so great. So we have vitamin C, vitamin A, and D. How about herbs? What are your favorite herbs for the immune system?
Echinacea,
Yeah,
andrographis, and elderberry.
great.
Yeah, yeah, I love them. They're wonderful. A lot of products on the market have combinations of them. And so that's really nice. Sometimes they even have some vitamins like vitamin A, vitamin C, and sometimes minerals like zinc. So one of the things I think to think about when you are purchasing an herb, whether it's in combination or by itself, is that the different dosage forms require different frequency of taking the medication. So if you get a liquid form or a tincture, that's generally taken every 2 to 3 hours, whereas a tea is 3 to 4 hours, and some of the tablets or capsules maybe 2 to 3 times a day. So that's a consideration.
Because they would take longer to break down and to be absorbed, so it's like a more, almost like a sustained release form in a way.
Yeah, a lot of the tablets and capsules are, and they're extracted, so they're even they're more concentrated than what you get in a tincture or liquid.
Any safety considerations?
Yeah, if you have an autoimmune disease or you're taking immunosuppressant drugs, you have to be careful because these will stimulate the immune system. And if you have a condition where your immune system's already too stimulated,
Trouble.
You're going to get into trouble. So that's a concern.
Yeah. Okay, so how about telling us a little more about echinacea?
Well, echinacea comes to us from a Native American tradition, and it's got antiviral and some antibacterial effect, and it's okay in pregnancy for short term. It increases the levels of the white blood cells, and it can be taken daily for prevention in low doses, and then much higher doses for treatment. A thing to remember about this is people who have allergies to ragweed might react to the echinacea. And also people who are on warfarin or Coumadin ought to be careful because it can change their coagulation.
I see. Okay, great.
The other thing to consider about it is that some people on antihypertensives can have a drug interaction with echinacea, so they should check with their pharmacist.
And I'm going to make a plug for pharmacists because people are told to check with their doctors, but actually doctors aren't trained in herb interaction or herb-drug interaction. And the doctor would just have to consult with a pharmacist to look it up in the database anyway. So
they don't like to consult with pharmacists.
but our viewers can consult with a pharmacist, right?
Right.
They have much easier access to a pharmacist.
Absolutely.
Yeah. So we have a Native American herb. How about a Chinese herb?
Andrographis is a great herb, and it's also from the Indian tradition. And what this does is it revs up natural killer cells in the body, in the immune system. And it's one of our first lines of defense. And if one gets a cold or flu, it may work a little better than echinacea.
Echinacea is better preventively, I think.
Well, it's also good for treating the flu, but I think this has a
it's more robust,
bigger
let's say,
punch.
when you're
more robust for sure. Now it should be avoided in pregnancy because there are some problems using it then. And if a person's taking a blood thinner, it's not a good idea to take it in that case either. Medications for high blood pressure, there also can be an interaction, and so especially the elderly, might find it lowers their blood pressure enough so that they might fall. So things to consider and check.
Right, that's a good point.
Yeah.
Okay, so you mentioned elderberry, and honestly, that's my fave. It tastes so good.
It does.
I like the elderberry honey syrups. They're kind of fruity and sweet. Yeah.
They're wonderful. It's also called sambucus nigra.
Sometimes people see it labeled like that.
Yeah. Now, the thing about this is you want to make sure you get it from a company that's very reputable because the unripe berries are actually quite toxic. So you need to be using a ripe berry to make the product. It's great for kids and for cooking because it does taste so good. And it slows down the viruses so they can't replicate as fast. Really great for respiratory symptoms. And elderberry tea, it's so wonderful to sip on that when you do have the flu. It's just really soothing. Absolutely soothing.
Yeah, and kids love it. Yeah.
And one of the things that I love with elderberry is, you know how when you have a cough and you get that awful little tickle in your throat, and especially right before you want to go to bed and you're laying there and you
can't sleep because of the tickle.
Away.
Yeah.
I love sucking on the tablets because they really soothe it and take it away.
Great. Okay, what about any other supplements that you might recommend?
Well, I like monolaurin too, which is an antiviral. And really conventional medicine doesn't have a lot of over-the-counter antivirals that aren't herbs
It's
for colds
true.
and flu.
What do they have? The doctor says go to bed and drink fluids. That's
Yeah.
what they tell you. Yeah, yeah.
This is actually found in breast milk, but the products that are on the market are made from coconut. They come in 300 to 600 milligrams per capsule or tablet. Sometimes you can find it in a powder. It kills viruses and it targets their cell walls and just breaks them down. The nice thing about this is that there really haven't been any reported risks or drug interactions or complications with using it. So it's considered actually a GRAS, labeled GRAS, so it's safe, for FDA labeled safe for
Generally recognized as safe. Yeah.
Yeah, so it's a good one.
Great. So we think of probiotics as being helpful for the immune system. Are there special ones for colds and
Absolutely.
flu? Or
Yeah, I think that there's probiotics that actually are meant to restore beneficial flora in your mouth. And they also will migrate into your nose, into your ears, into your throat.
interesting.
And they're going to help to make sure that that tissue is strong and actually prevent bacteria or viruses from getting past that mucous membrane. So the organisms that you want to look for are Streptomycetes salivarius, Lactobacillus reuterii, and Lactobacillus paracasei. And there's actually research behind this to back up the fact that they do help to restore these very essential probiotics in our mouth. Good to use after brushing your teeth and after using a mouthwash. And something to think about if you are using a mouthwash all the time, especially if you're using the kind of mouthwash that kills the bacteria, you're killing all your good
it's actually
bacteria.
not a good idea to take an antibacterial
So
mouthwash,
you might
right?
want to really think about replacing the good bacteria in your mouth by using a probiotic like this. Something to look for on the label if you have really sensitive milk allergies is that sometimes there's traces of milk in the product. So
I see. Okay.
you want to check for that.
So speaking of that, I'm thinking about how people these days would like to get, some people want to get everything from food. They don't want to take a pill or something, even a vitamin pill. They want to get everything from food. So what kind of foods would be most healing in the wintertime?
Well, believe it or not, there's a lot of research that shows that chicken soup is great for
Good
the
old
flu
chicken
or
soup.
for a
Yep.
cold. Really, really good. Garlic and ginger are great too. Garlic, eat as much as you can. Ginger is really good to add to your cooking. You can make a very good strong cup of ginger tea. You get the ginger root, peel the outside skin off the ginger, about a 2-inch slice, chop it up, put it in some water, simmer it for about 20 minutes, pour that into a mug, and add a little honey, teaspoon, tablespoon, and maybe some squeezed lemon would be really good, and then drink that down. What I love to do if I'm sick is to get into a nice hot bath with my ginger tea. And that really helps to warm you up. It also opens your pores so your body can throw out a lot of the toxins that you've developed from the infection.
Great.
It feels really good. There's a caution with blood thinners, so amounts of ginger and garlic that you normally eat and when your diet is fine, but
huge amounts.
high doses, you might want to be cautious if you're on a blood thinner.
So the idea of that steamy hot bath is making me think about steam inhalation, like maybe with essential oils.
Yeah, well, this is a good old-fashioned, treatment you can do at home.
Grandma's treatment.
Yeah, grandma's treatment. You get a bowl, ceramic or glass are better, and you fill it with water, the hot water, steaming, so that you have the steam come out. And you can add essential oils. Camphor or eucalyptus or peppermint are really good. And you don't need much. Just 1 or 2 drops is fine. That's plenty enough. And you put your head over the bowl, about 6 inches from it. Put a towel over your head so you make a tent, and breathe in really, really deeply. And you might want to close your eyes.
Oh, good. Yeah. Yeah,
while you're
makes
doing
sense.
that too.
Yeah.
Not a good idea for little kids. Be good. You can also place your ear over a steaming a container with the steam, and that'll help to reduce that congestion too.
Good.
You can use a steam humidifier or nebulizer. I really would not recommend using the essential oils in the nebulizer. It's just too strong. I'm really curious about your field of homeopathy. Do you have anything for prevention?
Yeah, we do. And you know, a lot of people don't know that homeopathy can be used preventively.
They don't?
Yeah. Many people know that it's a kind of natural medicine. It's very safe. It's very effective. Very well-known remedies for flu. But the idea of using it for prevention, I'm going to share with you my best tips from my practice. And I'll say that I have hundreds of people between my own practice and the Lydian Center, the holistic clinic where I work. Hundreds and hundreds of people get through a New England winter with not a single cold or flu with these products that I'm going to recommend. The first one is called Ferrum phosphoricum. That's the long name. We have a nickname, Ferrum phos, and an even better nickname, I call it nip it in the bud, because this is what you take the day before you get sick. You know, you're talking about the little tickle in the throat. You know how maybe you feel run down, you're not getting enough sleep, you don't have time to eat the way you know you're supposed to eat, and you're starting to feel under the weather, and you think you're really heading into getting sick. Or people who have kids, they know when their kids are about to get sick. The kids get their eyes are glassy, they get whiny, they're lying on the couch, they don't want to play their favorite Game Boy or whatever, they're not interested in their favorite food. Maybe their forehead's a little hot, but basically you don't have symptoms yet. There's no sneezing, there's no runny nose yet, but you're heading into it. You take Ferrum phos, 2 pellets, 3 times a day for a day or 2, and a lot of times it just heads it off at the pass. If it doesn't, then you have to take something that's more like kind of matches the actual symptoms. So I'll tell you that my other really favorite flu prevention, nip it in the bud, is for, it's kind of an all-purpose. It's for colds, flu, sore throat, ear infections, sinus infections, basically anything infectious or contagious. So specifically for flu, 2 very similar things. Maybe influenzainum may be hard to find in stores, but people can find it online. Or oscillococcinum, again, we have to have a nickname. Nobody can pronounce it. Oscillo, every drugstore has it. Every health food store has it. We're not recommending any brands. These 2, influenzainum is a generic. Oscillo is a brand name, but they basically do the same thing. I like influenzainum a little better. So what people do is they take 1 dose a week at the beginning of flu season for 4 weeks, then 1 dose a month for the remainder, and they take a dose every day that they're being like sneezed on by someone with the flu, like somebody in your family, somebody in your office. I have teachers in my practice, or somebody who runs a daycare center, and they'll say, well, every day of the winter somebody has the flu. To take it every single day all winter is a bit much, but those people could take it weekly. So that's the prevention part. Yeah.
That sounds great. What about if a person actually gets a cold or flu? What would you recommend then?
Well, then we become even more specialized. We have to actually match the symptoms. A lot of people, when they first get sick, they get that watery, drippy, we call it the nose running like a faucet, like you want to just stuff Kleenex up in your nostrils because you can't stand it. You might be sneezing a lot, and you got this kind of watery eyes, watery, drippy nose, maybe red mustache where it's all excoriated under the nose. The remedy for that is arsenicum, and the person who needs it might also be very anxious, very fretful, and oddly obsessed with having things very neat and clean. It's a really typical thing about arsenicum. If they take typical thing, any health food store will have this, arsenicum 30C, 1 dose is 2 pellets, 2 to 4 times a day, depending on how intense the symptoms are. Maybe that will totally cure it, or maybe it'll speed up the progress. Most people, when they get a cold or flu, they might be sick for 2 or 3 weeks. With homeopathy, I'd say 2 days at the most. They're back to work. They're back to normal life. So maybe they got the watery, drippy thing happening the first day, and the next day they're already into that thick, sticky, we call it like boogery kind of mucus.
Yep.
What we take for that is called calibic, and we remember it by saying, if it sticks, it's calibic. Then sometimes people have a flu. For the flu or any viral thing, when they're like so exhausted, they feel like a truck ran over them, they can't get out of bed, they can hardly even open their eyes. You can tell by the droopy eyelids. The remedy for that is Gelsemium, a flu or any viral condition when there's that level of really deep exhaustion. There are quite a few others, and I'll just mention another one that's my favorite because it's so great for little kids. The remedy Pulsatilla, and it's for the middle stage of a cold, where there's kind of creamy, like puddingy kind of mucus, and the child becomes very clingy and sweet and needy and affectionate and so forth. So those are my favorites. Yeah.
Those sound really great. So I know a lot of people are probably curious about how homeopathy works. Is there any research behind it?
There's wonderful research being done in India. Often we hear it can't work because there's nothing in it, but they have found what's in it with a very high power electron microscope. Basically, it stores information in the form of tiny crystalline structures in the water, and it's giving your body information that trains its healing energy. And there's a lot of research in Europe where people can choose a homeopathic primary care doctor, looking at thousands and thousands of people, either choosing a regular PCP or a homeopathic one. The ones going for homeopathy tend to have quicker resolution, milder symptoms, fewer recurrences. The parents are losing fewer days of work for a sick child. So it's really showing the effectiveness of homeopathy.